Let's talk about the epidemiology of cholera. Cholera is global. It has a widespread distribution and it is endemic in certain parts of the world, including South Asia, Sub-Saharan Africa, parts of the Middle East, as well as Latin America. Cholera is predominant in countries or regions where there is limited access to safe drinking water, inadequate sanitation, and breakdown of public health infrastructure. Globally, millions of cases of cholera are expected annually with tens of thousands of deaths. However, the true burden of the disease is often underestimated due to underreporting and weak surveillance systems. Cholera is seasonal. It has a seasonal pattern, often skyrocketing during rainy season where flooding contaminates water sources, and also during dry season where scarcity forces reliance on unsafe water sources. Transmission of cholera is principally based on the fecal oral route via contaminated water or food, especially due to raw or undercooked seafoods, fruits and vegetables washed with contaminated water. Transmission from person to person is uncommon, but it is often seen in settings with poor hygiene practices. Cholera is usually seen, it often follows humanitarian crises such as war, conflicts, natural disasters such as flooding, earthquake, and breakdown of water and sanitation facilities, as well as healthcare infrastructure. Well, that is basically about the epidemiology. Let's talk about risk factors. Certain factors predispose an individual to getting infected with Vibrio cholera to cause cholera and experiencing severe cholera complications. Such factors include lack of sanitation and poor hygiene practices, overcrowding, refugee camps, urban slums, as well as internally displaced persons camp usually have an influx of persons or individuals, leading to increase in spread of infectious diseases, including cholera. Low socioeconomic conditions is also another risk factor of cholera. Poverty reduces availability and accessibility of adequate hygiene facilities, healthcare, and education. And a lack of all these contribute to spread and transmission of infectious diseases, of which cholera is predominant. Malnutrition. Malnourished individuals don't have the privilege of getting certain nutrients that boost the immune system, and so these individuals are more liable to get infected with infectious disease such as cholera. Blood group O. Studies have shown that individuals with blood group O experience more severe cholera infections. So these are basically risk factors. Another important risk factor is reduced gastric acid. Certain conditions such as aclohydria or use of protein pump inhibitors like omeprazole, antacid use limits or reduce the production of gastric acid. And when gastric acid is limited in the stomach, it creates chances for Vibrio cholera to survive within the stomach and travel towards the small intestine. So these are basically the risk factors of cholera. Let's talk about diagnosis. The diagnosis of cholera is basically achieved through a combination of clinical presentation, laboratory investigation, as well as epidemiological context. In epidemic settings, the sudden onset of profuse watery diarrhea in multiple persons is suggestive of diagnosis, of presumptive diagnosis of cholera. Laboratory investigation or diagnosis of cholera is dependent on isolation and identification of Vibrio cholera in specimens, particularly stool and rectal swabs. These specimens are cultured in certain agar or certain medium, certain selective medium, especially the TCBS medium. with CCBS, which is the thiosulfate citrate bisalt sucrose agar, where Vibrio cholera is seen as forming characteristic yellow colonies due to sucrose fermentation. And then Vibrio cholera as well is oxidase positive, and other biochemical tests are carried out to confirm the presence of Vibrio cholera. Also, serotyping is done to detect the presence of 01 and 0139 variants of Vibrio cholera using various antisera. Rapid diagnostic tests is also available, and it is used to in outbreak detection as well as surveillance. And these rapid diagnostic test kits, they are available, and they are one of the major disadvantage of the rapid diagnostic test kit. It's its lack of specificity. Very important. Molecular methods such as the use of polymerase chain reaction are used to detect the presence of virulence genes and also to confirm diagnosis, but they are particularly used in reference laboratories. Prevention and control of cholera. Prevention and control of cholera is based on improving sanitation, availability of safe drinking water, as well as increasing hygiene practices. Also very important is health education, where individuals and the community is educated and enlightened on the science of cholera, as well as behavioral patterns to adopt in order to limit and eradicate the epidemic of cholera or cholera outbreak, as the case may be. Also very pivotal as a prevention and control strategy of cholera is surveillance. Surveillance, early detection or early detection of cases and outbreaks contributes immensely to timely intervention, and that helps in preventing severe complications of cholera. The use of oral cholera vaccines, that is OCVs, are very important. Oral cholera vaccines are particularly used in endemic regions to offer moderate protection against cholera. Treatment of cholera is the major cornerstone of cholera treatment is rapid and adequate rehydration. Rehydration drastically and dramatically reduces the mortality rate of cholera from over 50% to less than 1%. Oral rehydration solution, that is ORS, oral rehydration solution. ORS is the mainstay of treatment for mild to moderate cholera. In severe cases of dehydration, IV, that's intravenous rehydration, is used, particularly using the solution, the Ringer's lactate. This is the most commonly used intravenous rehydration solution. The Ringer's, in severe cases of dehydration, the Ringer's lactates or other forms of intravenous rehydration are utilized, and then they are followed by ORS as well. That is the oral rehydration solution, particularly when the patient can now take oral doses of rehydration. Also important is zinc supplementation. In children, zinc supplementation is very necessary because it decreases the duration and severity of diarrhea. Zinc supplementation, and it is followed as well by oral rehydration solution. Antibiotics use is also very, very essential. Certain antibiotics, particularly doxycycline, doxycycline, azithromycin, and ciprofloxacin. Certain antibiotics such as doxycycline, azithromycin, and ciprofloxacin are majorly used in as antibiotics in cholera cases. And the particular antibiotic used depends on local resistance and susceptibility patterns. And antibiotic use is majorly an adjunct, is used in addition to oral rehydration solutions.